Good morning. On this day in 1634, 150 European settlers sailing on the Ark and the Dove set foot on Maryland soil for the first time at St. Clement's Island in St. Mary's County. So even though we're in a state of emergency, I want to wish everyone a happy Maryland Day as our state celebrates its 386th birthday. 20 days ago, we confirmed the first 3 cases of COVID-19 in Maryland. All 3 were passengers on an Egyptian Nile River cruise. I immediately issued a proclamation declaring a state of emergency. We submitted a supplemental budget which included funding for emergency coronavirus preparedness expenses and emergency legislation allowing us to transfer all necessary resources from the state's rainy day fund. At my direction, the Maryland Department of Health began working with the Maryland Institute for Emergency Medical Services Systems to coordinate surge planning, and we elevated the state response to activation level. 19 days ago, I directed the Maryland Insurance Commissioner to require all state health insurers to waive any cost-sharing co-payments, co-insurance, or deductibles associated with testing for the coronavirus. 16 days ago, our state had 5 confirmed cases of COVID-19. We enacted our emergency legislation into law and convened a coronavirus response team composed of the leading doctors and scientists in the region. We canceled all out-of-state travel for state employees and advised all state agencies to prepare for a period of mandatory telework. 15 days ago, our state had 9 confirmed cases of COVID-19. I convened an emergency meeting of our entire cabinet, met with leaders of the state's long-term care community, and issued recommendations to our state nursing home facilities in an effort to protect older Marylanders. 14 days ago, the World Health Organization declared the coronavirus outbreak to be a global pandemic. Maryland had 9 confirmed cases of COVID-19. We immediately moved toward an all-appointment system at the Motor Vehicle Administration, and the Maryland Health Benefits Exchange established a special enrollment period specifically for the coronavirus. We restricted access to nursing homes and issued guidelines for all state veterans facilities. 13 days ago, we confirmed the first case of community transmission of COVID-19 in Maryland and immediately turned our focus from containment to mitigation. I directed the Maryland Emergency Management Agency to move to its highest activation level and enacted an executive order activating the National Guard. At my direction, all non-essential state employees began a mandatory period of telework. We restricted access to state buildings, including the State House, and issued an executive order prohibiting gatherings or events of more than 250 people. We closed all senior activity centers, closed the cruise ship terminal at the Port of Baltimore. We directed all hospitals to immediately adopt new visitor policies, suspended visits to all Maryland state prisons, and at the direction of Dr. Karen Salmon, State Superintendent of the Maryland State Department of Education, all Maryland public schools closed statewide for 2 weeks. 9 days ago, our state had 37 confirmed cases of COVID-19. I enacted an executive order to shut down all bars and restaurants, movie theaters, and gyms across the state, prohibited any gatherings of more than 50 people, and activated 250 Maryland State Police troopers of the Maryland Field Force to help with enforcement. I enacted an executive order directing the Maryland Department of Health to conduct an assessment to open closed hospitals and to take other measures necessary to immediately increase our capacity by an additional 6,000 beds. We activated the Maryland Medical Reserve Corps and issued an executive order to allow any practitioner who holds a valid out-of-state or expired medical license the ability to practice in our state. We activated 2,200 members of the National Guard and issued executive orders to prohibit utility companies from shutting off service or charging late fees, and to prohibit the eviction of any tenant during the state of emergency. 8 days ago, our state had 57 cases of coronavirus. I issued a proclamation to postpone the April 28th primary election and directed the State Board of Elections to implement a vote-by-mail system for the 7th Congressional District special election. We moved to 100% cashless tolling statewide to reduce person-to-person interactions and dramatically reduce MARC train, local bus, light rail, metro, and other commuter bus services. 7 days ago, it was my sad duty to report the first death in Maryland as a result of the coronavirus pandemic. As chairman of the National Governors Association, I convened and led a call with all of my fellow governors across the country. We agreed to 5 immediate priorities that we requested of the federal government. First, we agreed to push for dedicating at least 50% of the Phase 3 supplemental directly to the states. We second push for increased access, production, and supply of PPE, masks, test kits, ventilators, and other supplies. We push for authorization of Title 32 to give governors maximum flexibility with the use of the National Guard. Fourth, governors agreed to push the federal leaders to provide guidance on how the Defense Production Act could be implemented. Fifth, the governors requested a delay and greater flexibility in both the completion of the 2020 census and the transition to Real ID. 6 days ago, at my direction, the Maryland Department of Transportation began restricting access to the BWI terminal for ticketed passengers and badged airport employees only. We also amended our previous executive order based on new CDC guidelines to prohibit events of more than 10 people in close proximity, and we closed all enclosed shopping malls and entertainment venues. The Board of Regents of the University System of Maryland made the decision to keep students off campus for the remainder of the semester. Through Phase 1 of our hospital surge plan, 900 beds had been made immediately available, and a new floor was activated at Mercy Medical Center in Baltimore City. 2 days ago, we had 288 confirmed cases of COVID-19. I enacted an executive order closing all non-essential businesses in the state, ramped up enforcement actions against crowds and gatherings, and rolled out a $175 million immediate relief package for Maryland workers and small businesses. And while we're thankfully not at the level of infection and death that we're seeing in some other states, we've been taking swift, aggressive, and unprecedented actions in an effort to stop hundreds of thousands of people from becoming infected and to save the lives of thousands of Marylanders. Yet in spite of these aggressive actions, this crisis continues to escalate at a rapid pace, and as I have been repeatedly warning over the past 3 weeks, as of this morning, Maryland now has 423 confirmed cases of COVID-19, an additional 74 cases in the past 24 hours, which is the largest one-day rise to date. We now have positive cases in 22 out of our 24 jurisdictions. Sadly, yesterday, a Prince George's County man in his 60s who suffered from an underlying medical condition became the 4th Marylander to have died as a result of the coronavirus. The first state employee died of COVID-19, a research professor at UMBC who actually lived in New York and is counted as a New York case. 2 midshipmen at the U.S. Naval Academy here in Annapolis, and several members of both the University of Maryland College Park and Anne Arundel Community College communities have also tested positive for the virus. While COVID-19 still appears to be more deadly to older citizens over 60, 217 individuals with the virus in Maryland are between the ages of 20 and 50. The vast majority of people in our state who have tested positive so far are in their 40s. And we have children as young as 10 months old who have the virus here in Maryland. There are now more than 900 cases in the Capital Region, 55,000 cases in all 50 states across America, and 436,481 cases in 196 countries around the world. And the reality is that this crisis is really just beginning here in our state and across America. And people are looking for certainty, but the truth is we simply don't yet know how bad it's going to get, or how long it's going to last, or how successful these social distancing actions are going to be in flattening the curve. What we do know is that it is not going to be over in a matter of days or even weeks. And as I have been saying over and over again since day one, the number of cases is going to continue to rapidly and dramatically rise. It is critically important that every single person remains vigilant and continues doing their part by staying in place in their homes as much as possible so that we can break the back of this virus. According to the CDC guidance that was issued yesterday, any Marylander or anyone visiting Maryland who has recently spent time in New York or visited the tri-state area must quarantine in place and limit all contact with others for at least 14 days. I have formally submitted a request for a presidential disaster declaration for the state of Maryland to help provide funding for state and local governments as well as nonprofits for such important initiatives as disaster unemployment insurance, hazard mitigation, and emergency protective measures. This disaster declaration will be another important step in our aggressive and coordinated response to COVID-19. Later today, I will be chairing another call of the National Governors Association. The nation's governors are working hard to speak with a unified voice and to drive further decisive action from our leaders in Washington. We have another call scheduled for tomorrow with the governors and with the White House, and we will continue to push for greater progress on the priorities that we submitted last week. We still need much more progress on ramping up the production and delivery of PPE, test kits, ventilators, and other necessary equipment. We still need more federal resources directly to the states that are on the front lines of this crisis. Last week, the governors requested that one half of the stimulus package, the third stimulus package, go directly to the states. And I pressed the issue in calls with the Vice President and with the Treasury Secretary and leaders in both houses of Congress. The good news is that the Senate has agreed to some aid to the states, and while it's still not enough, I know that they're negotiating back and forth with the House, and it's encouraging that both parties seem to have reached an agreement. I urge Congress to pass the stimulus package today, and I want to thank our federal partners for taking swift action on this, although we're going to come back again and ask for additional funding for the states and local governments to help with this crisis in the next round of stimulus. We want to thank them for taking swift action on extending the deadline for the 2020 census, which we pressed for, and for acting just this week to extend the deadline for the transition to Real ID, which we requested. We're still awaiting final action on Title 32 for all of the states. They did it for the first 3 states that are having the biggest issues, but all of our citizen soldiers that are stepping up in each of the states need the exact same help so that FEMA and the federal government can help cover the cost of these National Guard's important relief missions. We continue to make rapid progress in our plan to increase hospital capacity here in Maryland in order to meet the demand created by the escalating spread of the virus. Last week, we were successful in making 900 beds immediately available within our existing hospitals by freeing up capacity. As of today, we have now been able to make 2,400 beds available, which is actually weeks ahead of the schedule that we had been shooting for, and it's good news. Yesterday, I toured a site of a field hospital in the Baltimore Convention Center. The National Guard is ready. It's a great partnership between the University of Maryland Medical Center and Johns Hopkins. The Guard, working with a number of our state agencies, we're waiting for FEMA to deliver these beds and the equipment needed, and then we'll be ready to get that off the ground. We're also expanding the capacity of our clinics and hospitals. But besides expanding the physical footprint, we also need to expand and in addition to the stuff that we're looking for help on from the federal government with respect to the supplies needed, we also must expand the manpower that's required to staff these facilities. And so, as I mentioned earlier, I issued an order last week to fast-track the licensing processes for out-of-state healthcare practitioners and those here in our state with expired medical licenses. I also issued an order to provide more authority to credential emergency medical technicians and paramedics to be able to work in our clinics and field hospitals. And we activated the Maryland Medical Reserve Corps, which is a force of 5,000 dedicated to medical and healthcare and other professionals who had volunteered and ready to assist in any public health emergency. And last week we had 700 members of that corps that stepped up and raised their hand, volunteered for service, ready to be activated. Since Friday, more than 2,300 more people have signed up to be a part of this initiative, bringing the total workforce up to more than 7,300 individuals who are willing to assist. These volunteers have signed up from every single jurisdiction in the state, including both medical personnel and people from other professions, including behavioral health specialists, engineers, child care workers, and teachers and construction workers, all willing to help with the crisis. In the spirit of service in Maryland, it's always really at its best when we need people the most, but we still need more help, and so we encourage people to continue to take a look and at how they might be able to help their neighbors and their communities. Today, I'm directing the health department also to immediately institute a program to encourage and to allow medical students and nursing students and people studying to get degrees in medical technician studies from our universities, our colleges, and our community colleges to be able to be a part of this program and to assist and be a part of the effort. To sign up, to try to be a part of this program, you can go to mdresponds.health.maryland.gov. To help older Marylanders get through this crisis, Maryland has just received $4 million in federal funding to help our communities provide at-home meals for older adults, which is important since community centers are closed and some family caregivers are unable to assist older loved ones. Maryland is also the first state in America to provide free telephonic service to check in on older residents, and we're urging Maryland seniors to make use of this service during the COVID-19 state of emergency so that they can receive a check-in call every day at a regularly scheduled time where we'll have someone touch base with them to make sure that they're okay and see if they need any help. To sign up for that, you just call 1-866-50-CHECK. We encourage our seniors to take advantage of that. Last week, we launched the Maryland Unites initiative to highlight ways that Marylanders can volunteer in assisting their neighbors and communities in the days and weeks ahead. And we encourage people that want to help to go to Maryland Unites. Over the next 3 days, the University of Maryland will be partnering, University of Maryland Medical Center will be partnering with the Red Cross. I mentioned last week I spoke with the national president of the Red Cross who said they have a critical need for blood here in Maryland and across the country. We're going to be partnering to hold a blood drive to address the critical shortage that's been caused by this pandemic. So those interested in participating in the blood drive can sign up at redcross.org. Individuals and businesses across Maryland continue to step up to help aid in this massive effort to slow the spread of COVID-19 and to help their neighbors. There are hundreds. I just want to give a shout out to a couple, including Sagamore Spirit Distillery. I mentioned before that many of our small distilleries were working on this, but Sagamore is a pretty big operation. They now have begun the process of making hand sanitizer for Johns Hopkins. The distillery is working on an initial batch of 54,000 liters with the plans to make much more to meet the escalating demand caused by the crisis. Last weekend, Marlin Steel Wire Products, another Baltimore-based manufacturing company, had their workers fulfill a huge rush order to make stainless steel COVID-19 test tube racks. And I just want to thank those two companies and all the other large and small businesses who have stepped up to be a part of this all-hands-on-deck effort. Dr. Karen Salmon, the superintendent of the Maryland State Department of Education, has some major announcements to make regarding the Maryland Public Schools and child care facilities across the state. But before I turn the podium over to her, I just want to take a moment to speak directly to Maryland's parents, teachers, and students. I know how incredibly difficult and confusing this last couple of weeks has been for you. Teachers want to know when they'll be able to get back to their lessons and when they'll see their students again. Parents are concerned about how their kids will be able to continue to learn, how they're going to be able to handle child care, and the students want to know when they'll be able to get back to their normal lives and when they can see their friends and their classmates again. There's a lot of confusion and fear and anxiety and uncertainty right now. It's frustrating and challenging. I just want all of you to know that there's nothing more important to us than your health and well-being and your education. And I want you to know that there are a tremendous group of people, your superintendents and people in your local school systems and the State Board of Education, a whole lot of people working across the state around the clock to try to come up with good answers to these questions. And I want to thank them for their efforts. We're all in this together, and we will get that through this together. So thank you, and with that, I'll turn it over to Dr. Karen Salmon.
Thank you, Governor. After lengthy discussions with health experts from around the state, I have made the decision, along with the State Board of Education, to extend the closure of all public schools in Maryland for an additional 4 weeks through April 24th, 2020. We do not make this decision lightly. However, with the challenges facing our state and our country, we have a responsibility to ensure the health and safety of our school communities and the communities at large. I'm working in concert with all local school system superintendents, including multiple calls per week, in order to provide the continuity of learning to all of our students in every jurisdiction across the state of Maryland during this time. We are already working very closely with every school system to address issues affecting their ability to provide educational services to all of their students. It also should be noted that we will be diligent in providing educational services to our students with disabilities. Local superintendents have provided me with their plan for the continuity of learning during this additional closure period. My staff at the Maryland State Department of Education has been reviewing the plans and determining what supports and resources the state can provide where needed. More information will be available in the coming days as we work collaboratively on a statewide plan that maintains equitable standards and expectations for students. Local school systems will be communicating with their individual school communities as they move forward with implementing their plans. We also plan to resume the continuity of learning next week and will be working closely with local superintendents, school administrators, and our teachers to activate that plan. While it is too early to definitively say exactly when schools will reopen, we will continue to reassess the situation as we move forward. Additionally, while child care and daycare facilities throughout the state, they may remain open at this time, our urgent focus is ensuring that there are child care options for the children of essential personnel. We understand that those in the workforce providing essential services, such as those in our hospital and healthcare facilities and food distribution sites, may need child care provided to continue in their roles. However, if another parent or guardian is able to stay home with your children, you should do that. Your children should be home with you. For those essential personnel that are unable to provide care, we have worked diligently in the past week to identify locations across Maryland that will provide child care. At this juncture, we have identified space for more than 1,200 school-age children of essential personnel at various locations throughout Maryland in spaces such as the YMCA's, the Maryland School for the Blind, public libraries, parks and recreation facilities, and boys and girls clubs. We are hoping to increase this capacity to more than 2,500 spaces in the coming days. Essential personnel working in response to COVID-19 pandemic who require child care are immediately able to register for these services through a free referral hotline called LOCATE, L-O-C-A-T-E. The number to reach this referral is 1-877-261-0060. We will provide additional guidance and information immediately following today's press conference on the Maryland State website. I am so grateful for our educators and child care providers across the state for their commitment to our children and their school communities. I also want to recognize the incredible dedication and commitment that our food services staff and volunteers have exhibited as they have continued to serve and transport meals to children at the 500-plus food distribution sites we have set up across Maryland. Just as a reminder for any family looking for a location to pick up meals for a student, please visit mdsummermeals.org for a list of the locations in your area. I appreciate everyone's cooperation during this difficult time, and I'm looking forward to working with our local superintendents and school leaders in the coming days as we move forward.
Thank you, Dr. Salmon. I want to give a special shout out to the things she just mentioned about opening up the centers where we're making sure that the kids get fed. I had the opportunity to visit one of them yesterday in Baltimore City. And I remember we first announced that we were going to make sure kids got these meals, and I think the first time we said we have 143 open, and then we said we had 300 open. Now we have over 500 of these open, and they're doing a wonderful job. So I want to thank all the people, including our National Guard, who are assisting with the schools to try to get that done. So thank you all for the work you're doing. With that, I'll be happy to take a couple of questions.
Governor, you said you closed the rest of the non-essential small businesses because you're frustrated by how people were reacting. Is there a chance that soon or in the near future that you might go to a shelter in place, or you think Maryland is refusing the warnings?
So, there are a lot of this is like semantics about how people describe things. There are a number of states who said they were sheltering in place, but that they were still leaving all these businesses open, and they were just saying, we're going to have shelter in place, but you can still go out and do all these things. We did it the opposite way. We said, we want you to shelter in place, but we're going to close all of these non-essential businesses. I believe ours is actually more effective. There was a thing came out yesterday that said we were the third most aggressive state in the country, and we're not nearly as affected yet as places like New York and California and Washington, but we're taking pretty aggressive steps. So instead of ordering people in their homes, we're just encouraging them to stay in their homes, and we're keeping them from going in large groups, and we're keeping only the businesses open that are important. We've had tremendous cooperation. I want to thank the people of Maryland for cooperating with these directives, because while at first people are taking it much more seriously. We had 500 and some calls from between the state and local police about going out doing checks yesterday. I think we only had 14 incidences statewide of groups where they had to say, hey, please disperse, you got more than 10 people congregating, and every one of them willingly, immediately cooperated. So we've had no real incidents of people ignoring the directives.
Talking about quick call, talking about small businesses, what do you say to some people that might go with the theory of, well, I'm going to stay open until I get caught?
So far, like I said, we have had No incidences. We have 14 cases of crowds. We have had, to my knowledge, very little problem with businesses saying they're going to stay open until they get caught. And essential businesses are staying open, and we want them to stay open. They've got to provide the things that people need. The ones who are not essential need to be closed down, and if they're not, and we find out about it, they're going to be closed down. Right?
I know to a degree I keep sort of asking the same question. The 4-week extension for the school at least, it's been suggested to me that you perhaps have gotten some guidance from the health department that the peak might not come until May. Do you have any hope at this point, any indication that 4 weeks additionally might do it for the schools?
Yeah, honestly, I think that's something maybe Karen would want to address, because she's had conversations not only with the health department, but with all the local superintendents. There's obviously, none of us can say in 4 weeks everything's going to be great and it's going to be safe for all the kids to go back to school. It's somewhat aspirational, and it gives 4 weeks for us to try to have all the local schools prepare, make sure the continuity of education, that they're providing all the things and getting the, it would be wonderful if we get to the point where we've bent the curve and we can, but obviously we're not going to send kids back if things are unsafe and we're still climbing and people are getting infected. So at some point, I think over the next 4 weeks, they'll be watching it and monitoring it on a day-by-day basis, and that school system, may make additional decisions in the future. Like the first time, they said that we're going to close for 2 weeks and reassess, which is what they did, and nothing is carved in stone. But I think right now the decision is to spend those 4 weeks trying to figure it out.
Governor, the package that was passed in the Senate overnight, I know is relatively new, but do you have a sense, based on that package, of what Maryland can expect from it, and what should the House add that would perhaps make it better for Maryland?
So I know our team knows the exact dollar amount, but we pushed for 1/2 of the entire stimulus package. All 55 governors did. We did not get that. We said that the immediate already expended dollars that we needed was about $150 billion, which is in the Senate package. This is for all the states. They put the immediate $150 billion in the Senate. It hasn't passed the House yet. We're hoping it will this morning. That does include some money that Maryland needs. Not nearly enough for us or the other states, and we'll be talking about that further this afternoon with all the governors, and we'll be talking about it further tomorrow with the White House and with the leaders of Congress.
We talked about 24 hours ago. We talked about masks, PPEs, testing kits. You said there was still a struggle to get that. Is that still the case 24 hours later? Has it improved at all?
Yes and yes. Yes, it's still a struggle. Yes, every state is still short of all of those things. But yes, we've also seen some improvement. So from the standpoint of, we have received some supplies through FEMA, not enough. We have seen some of our own supplies we've been able to get in through private sources, but there's no question there's still shortages of all those things, which is why we keep pushing at the state level and the states collectively pushing at the federal level.
Just to follow up on that question, and you mentioned a company's making stainless steel test tubes. How many test kits does the state have, and how many of the additional supplies do you need to be able to process them? We're talking about swabs, be able to the transport medium to make sure it's shipped securely, pipettes. What is missing there, and where does that need to come from? I'm assuming if you can go buy it today, you would have bought it already.
We've been attempting to buy all of those things everywhere across the globe, and we're buying things from other countries. We're buying things across America. We're pushing for all of that, but we put a request in through FEMA, I think, for 138,000 test kits, which we have not received. All of those things, there are many things in. It's not as simple as saying how many test kits. As you pointed out, there's swabs, there's reagents, there's many components of the test kits, and the state doesn't really have them all. The state lab has a certain amount that we use. The hospitals are also doing their own purchasing. The labs, the private labs, are doing their own and buying their own. So we're doing an assessment and an inventory of exactly what everyone has and what they need, and we're trying to help them all get more of everything. And so it's not an exact number, and it's changing almost every day and hourly. What's coming in, it's much better than it was last week, and nowhere near where it needs to be. That's.
Could you talk a little bit about what the big spike means
Yeah, that's a great question, Ovid. Mostly we're doing a lot more testing. So at the beginning, the testing was restricted to only a certain number of people. Then it was broadened. We were only doing the state lab testing. Now there's multiple hospitals doing their own testing. There's multiple private labs doing testing. And so the higher numbers do not necessarily mean that things are getting worse. It just means we're testing more people. And so we're trying to get we don't have enough data to figure out all of exactly what it means, but it's not as alarming as it sounds because it's just a lot more people getting tested. Doesn't mean the percentages are going up.
What about open for business by Easter?
Sorry.
Is there any thought to summer school?
I know that that's one of the things that they're talking about. I don't know if you want to address that, but yeah.
Thank you, Governor. You know, we are going to look at all kinds of creative solutions going forward. We may look at an extended year. We just haven't, we're trying to get geared up to do the continuity of learning piece first, and then we'll have some time once we get that down and get to understand how effective that is. Then we can start planning for other kinds of things that we might need to going forward. Thank you.
Can you talk a little bit about what the continuous learning, I know each district will have its own way of doing that. I know Insurance County, for example, has said they don't want to try to do remote learning because they're worried that not every student has a laptop or webcam at home. What are some of the solutions that you're hearing from the districts?
Well, the plans are going to all hopefully be on their websites very soon so that folks can go on and look and certainly compare from one place to another. But what I'm going to try to do, because I think it's really important for equity across the state, is to come up with what are the standards that we really expect to have to be the baseline that everybody gets. And then if other districts are able, because they can do more remote distance learning, they can add on to that. But we want to make sure every student has the basics going forward this next 4 weeks. And we also are going to have to come up with some very creative ways to make sure we're educating our students with disabilities.
What do you tell the parents right now who are out there with end? I've talked to some parents who are saying, I don't know what else to do with my child. I'm not a math teacher. I'm not an English teacher. What are some assistance you can provide to those parents right now who might be at their wit's end?
And by the way, I've heard from many of those parents as well. I think that, again, the local school systems are going to do their very best to push out resources. I sent something just recently. As the governor says, we're not sure, it seems like months we've been doing this, but last week we sent out it was about 35 pages of websites that parents could get on and click on just through the links. So we're really trying to push out resources to parents in the interim.
I have a question that parents are worried about. The narrative before the cases were confirmed in Maryland was that children may be carriers but are largely asymptomatic. Can you give us any details on the circumstances that led to the 5 pediatric cases? Were they showing symptoms? They have the high fever, or was it part of contact tracing?
Yeah, that's beyond my doctorate.
We have another smart woman for that one.
It's something that parents keep asking me about without, I know there's identifying information you can't reveal, but it would put a lot of parents at ease.
Sure, understand that question. And as the governor said, we are seeing in our confirmed cases, as well as in other states, we are seeing not just older people, as has been typically the message, but we see that across all age groups, including children. The difference is that it appears that younger people are less likely to get the severe form of the disease and be hospitalized as opposed to younger people. The children that we have here in Maryland, for example, have not been hospitalized. However, that makes the point of how very important it is that people stay home and that there's not the kind of mixing, unfortunately, even between generations that we take for granted, because children absolutely can have this disease and can be spreaders. So it's something to be aware of.
So is it safe to say it was large, I'm sorry, I just want to make sure I'm hearing this right, through the contact tracing, I think the governor...
Absolutely, and I do want to say that the work of the local health departments for every one of these cases has triggered a very thorough investigation by the local health department to go through all of the comings and goings, the whereabouts of all of these cases, so that people who may have been in close contact and may have been at risk are notified and as well as being tested.
Do you know how
Yeah.
many people are hospitalized at this point? How many have recovered? How many are hospitalized out of that number?
I tell you, that is a very fluid number. We're watching that very closely. Every day we get a report, and every day it's going up. We have reports coming from hospitals, from our hospital partners, as well as from our EMS partners. So we are at a point now, we are not in a crisis situation with regard to hospital beds, and in large part, that's because hospitals, providers have taken advantage, have complied with the orders to say it is now time to cancel elective, non-urgent procedures. And so in so doing, we see a dramatic drop in the usual census, but we are watching very closely to make sure that there's adequate capacity going forward.
Ballpark percentages, like, so we have this over 400 now. How many are recovered? How many are hospitalized?
Yeah, we know of right now 17 individuals of that cumulative number who are now fully recovered. They're outside of their isolation period, and we're very happy that they're back and being healthy. We're watching that very closely, as well as the hospitalization rate.
There's been some discussion about the hydroxychloroquine and the Z-Pak and some of these new treatments that are out there. Are we using those in Maryland? Some of the argument that one of those drugs is used for lupus, there's a shortage on it. Has your office been reached out?
Yeah, we're watching that. These are established drugs that are on the market, and they have very important uses for people who have, for example, lupus and other conditions which absolutely depend on access to these drugs. So we're watching very closely that supply.
Ms. Phillips, so the team who recovered, will their antibodies be used if you have
Yeah,
others?
right. There's really important research that's going on now to see if those people can contribute plasma, for example, that would have protective antibodies. And so those people, again, an example of Marylanders stepping up, they have come forward and identified themselves to us as being willing to participate in those studies. Yeah. Yeah.
Some states are providing information about the number of people being tested. Is that something that Maryland can
Absolutely. We're working to get our arms around that. As the governor said, we have testing going on at the state lab. We can certainly get our arms around that. But the hospital testing as well as the commercial labs, these are high-volume laboratories that are located outside of the state. So while they all must immediately report to us on a positive case, and they do, what we want to know now is exactly how many tests they're doing that are negative, so we get a sense of the volume and also the positivity rate for our state.
Governor, I know this pandemic has taken up a lot of share of your energy, but have you had any chance to reflect or any thoughts about some of the bills that were at the end of the session, and that some of those will have some effect on the Maryland economic? Have you had a chance to review or know what you think we're going to do there?
I have given absolutely zero attention to any of the 680 bills that were passed at the end of the legislative session. I know that we have a legislative team that is all out of the office, working remotely from home, who are looking at those. But actually, no bill has been sent to the governor's office. The legislature has not forwarded any bills. We expect sometime over the next month they will. We then have a month to review them. The Attorney General's office will review them all and then give us advice, and then our team will look at them. Quite frankly, I have no time to review 680 bills. That's we're trying to keep people alive.
Governor, can you talk about the Vice President on Monday mentioned something about possible breakthroughs, perhaps with ventilators. Can you tell us a bit about what you heard in the meeting on Monday and what you might be hoping for in terms of breakthroughs coming in the next day or two?
Well, the good news is, I think in part of our package that we received from FEMA, perhaps yesterday, we did have a delivery of ventilators. It was not the amount that we requested and not enough, but we appreciate them. And we'll be distributing some of them out to our hospitals. But the Vice President and I had a personal conversation about this. He also talked about it in his press conference about the ramping up of production of ventilators, which they're trying to do at the national level, and also about the conversion of a certain type of ventilators that with a small modification could be utilized. And if that's something, we've discussed that with our team here, with all of our doctors and hospitals, and they think that that's also promising for at least a small part of the solution.
How many did you ask for? How many did you get?
I'm not sure we want to give that out, but it was a pretty sizable chunk of what we asked for, but not all.
That's it, folks. Thank you.
All right.
What do you say about Easter?
What's that?
What about this Easter goal that we've heard elsewhere?
Look, I'm a hopeful guy, and I would certainly love to have the thing all resolved as quickly as possible, but I don't think we can predict what this virus is going to do, and I think you can't put a time frame on saving people's lives. We're going to make decisions based on the scientists and the facts.
Thank you.
All right, thank you.
Thank you.